I was diagnosed in 2005, but I was experiencing symptoms for many years prior to that, and it took a really long time, and I had to get really sick before they found out what was going on.
May is Lupus Awareness Month, and patient Stephanie LaRoque, alongside Montreal lupus specialist Dr. Sasha Bernatsky, are spreading the word on the latest patient therapies and how best to stay hopeful when managing a lupus diagnosis.
Hi, Stephanie. Come on in.
I was exhausted going to bed at 8 p.m. I had skin rashes. I had a lot of pain in my body. I was losing my hair. And it was a rocky time till I got stabilized. And a lot of that was me kind of in denial about my illness, being a young woman who, wanted to keep up with her friends.
According to the Canadian Spondyloarthritis Association, women account for 90% of Canadians who are diagnosed with lupus. Dr. Bernatsky says of this subset, many are diagnosed during childbearing age.
A person can have a lot of questions. If you're diagnosed with lupus in your 20s or even younger, it can be a bit discouraging and it can almost seem overwhelming. So the amazing thing is now we do have strategies that can really optimize the health.
It means making some lifestyle changes that are not always easy, maybe changing diet, working less, reducing my hours. I had a huge pill case of pills that I would just take, not even really understanding how or why it worked. I was just hoping it would work. And then one day they asked me to be part of a clinical trial. My mind shift changed of taking my health seriously, that this was a serious illness and I really had to do my best. I wanted the results of the trial to be well, so I wanted to be a good patient. And I started to get better.
Though there's currently no cure for lupus, Dr. Bernatsky says the key to managing the disease is controlling the overactivity of patients' immune systems without compromising regular immune function.
Some of the beneficial developments have been using drugs that are often first discovered to be useful in things like organ transplant, where they need to control the immune system, or cancer, where, again, there's a lot of interplay with that immune system. We started getting some data on a special drug that was meant just for lupus, so that's called belimumab. That was the first time that researchers were able to isolate a protein, a molecule that could affect the immune system in a beneficial way to keep lupus activity controlled without hopefully causing too many side effects.
The most important thing you can do is talk to your doctor, tell them how you're feeling, be open, be honest about your fear, your anxiety. It is a new reality you have to live with when you have a chronic illness. You have to see your life in a different way. Your illness is always with you. I work with my doctor, they work with me, and hopefully that'll work for the future patients as well.
For more information on lupus and how you can help the Montreal General Hospital, head to Lupus Canada online or visit our website at montreal.citynews.ca. In Montreal, Anastasia Dextrene, City News.